The shocking truth about prescription medications for enlarged prostate, BPH. Are you or someone you know taking medications for an enlarged prostate? You might be shocked to learn what these medications really do and don't do for your health. Stick around, because the truth might surprise you. Benign prostatic hyperplasia, or BPH, is one of the most common health conditions faced by men as they age. By the time men reach their 50s, nearly half experience some degree of prostate enlargement, and by their 80s, the majority are affected. But what exactly is BPH? The condition occurs when the prostate gland, which lies just below the bladder, begins to enlarge. This enlargement can compress the urethra, making everyday activities a struggle. Symptoms like frequent urination, waking up multiple times at night, weak urine flow, or even trouble completely emptying the bladder can disrupt your quality of life. What's the typical solution? For many, it's prescription medication. Doctors often recommend alpha blockers or 5-alpha reductase inhibitors to manage symptoms. However, the real question is, are these medications addressing the root of the problem or merely masking the symptoms? That's what we're diving into next. There are two primary categories of medications commonly prescribed for BPH. Alpha blockers like tamsulosin are designed to relax the smooth muscles in the prostate and bladder to ease urination. They work relatively quickly, often within days or weeks, offering short-term relief for many men. 5-alpha reductase inhibitors like finasteride, on the other hand, work on a longer timeline. These medications shrink the prostate by blocking a hormone called dihydrotestosterone, DHT, which is linked to prostate growth. It can take months for these drugs to show results. On the surface, these options sound promising. After all, who wouldn't want to alleviate the symptoms quickly or potentially reduce prostate size over time? But what you may not realize is that these medications often come with strings attached. Strings that not only tug on your health, but also your peace of mind. Detailed list of side effects like dizziness, reduced libido, erectile dysfunction, and more, highlighting the common side effects and limitations of such treatments, while advocating for informed choices and lifestyle changes as effective alternatives. Here's the part most men aren't prepared for: the side effects. While these drugs may help manage symptoms on a surface level, they also come with a laundry list of potential downsides. Alpha blockers can cause side effects such as dizziness, fatigue, and low blood pressure, particularly in older adults. Imagine trying to maintain an active, independent lifestyle while constantly feeling drained or lightheaded. 5-alpha reductase inhibitors, on the other hand, often lead to sexual dysfunction. Many men report reduced libido, difficulty achieving or maintaining erections, or a noticeable impact on overall intimacy. For some, these issues persist even after stopping the medication. But the complications don't stop there. Research suggests a link between long-term use of these medications and depression in some men. Add to that the frustration of waiting months for results, only to find the drug might not even work for you. And it's clear why so many seniors are searching for better options. Can you imagine enduring all these side effects, only to realize the medications are not a cure? They may manage symptoms, but they don't address what's actually causing your prostate to enlarge. So, are there better, safer alternatives? Here's something that often gets overlooked. Not every case of BPH requires medication. In fact, some men manage their symptoms effectively through simple lifestyle changes and non-prescription solutions. Dietary improvements can work wonders. Foods rich in antioxidants and omega-3s, like tomatoes, salmon, and green tea, may reduce inflammation and support prostate health. Cutting back on caffeine and alcohol can also reduce urinary frequency. Regular exercise is another game changer. Even moderate activity, like walking or swimming, can help maintain a healthy weight, improve circulation, and reduce the pressure on your prostate gland. Natural supplements such as saw palmetto, beta-sitosterol, and pygeum have gained recognition for their potential to ease BPH symptoms naturally, without the risks associated with pharmaceuticals. These alternatives not only help alleviate symptoms like frequent urination or weak stream, but they also carry little to no risk of long-term complications. Imagine tackling BPH in a way that enhances your overall well-being, rather than compromising other aspects of your health. Why, then, are lifestyle changes and natural options not the first line of defense? The answer often lies in the economics of healthcare. The pharmaceutical industry generates billions of dollars from prostate medications every year. It's no surprise that these drugs are frequently recommended. They're a long-term moneymaker. However, healthcare should never be about one-size-fits-all solutions, especially for seniors like you. Your prostate health is unique, and so are your needs. That's why being informed is so important. During your next doctor's visit, ask pointed questions. Do I really need medication right now, or would diet and exercise work just as well? What are the long-term risks of these prescriptions? Are there natural therapies that might address my symptoms without the side effects? Taking control of your health is empowering. It's about working with your healthcare provider as a partner to explore all options, not just the ones that come with a prescription pad. By now, you've learned about the possible downsides of BPH medications and the untapped potential of lifestyle changes and natural supplements. So, what's your next step? It's time to prioritize a more personalized, proactive approach to your health. Prostate issues can feel overwhelming, but they're not insurmountable. No matter how long you've been dealing with BPH symptoms, there are safer, more effective strategies to reclaim your quality of life. Whether that means taking a closer look at your diet, committing to daily exercise, or exploring natural supplements backed by science, the choice is yours. Click the link in the description for our top recommendation. Are you ready to discover a safer, more holistic solution for managing your BPH? Click the link in the description below to learn more about our top recommended alternative. Your health, independence, and well-being are worth it. Remember, taking control of your prostate health starts with understanding your options. Hit subscribe and stay tuned for more tips on maintaining your health and vitality, because you deserve nothing less. Thanks for watching. If you found this video helpful, don't forget to hit the subscribe button and give it a thumbs up. We'd love to hear from you. Share your thoughts or personal experiences with BPH treatments in the comments below. Your story could help someone else. And don't forget to check out the link in the description for our top recommended solution. See you in the next video.